Dulu re, dulu, talinan dulu re, tali lalamba. Dulu re, dulu, talinan dulu re, tali lalamba. Ami kanta hotu ona maung alin sira, kanta dia kanta at, ami kanta ona. Kanta dia, kanta at, ami kanta hotu ona. Dulu re, dulu, talinan dulu re, tali lalamba. Dulu re, dulu, talinan dulu re, tali lalamba.
Dr. Dan Murphy. I'm from the United States, but since 1998 I've been working here in East Timor. Right now I'm at the Bairo Pite Clinic. In 1999, after the election and after all the trauma that this country underwent, we opened up this clinic. Since then, we have now seen 500,000 patients in this clinic. That's quite a bit of work. Of course, we have an enormous number of problems. What I'm going to try to do now is explain some of the cases that we run into that are beyond our means to do an adequate job for. Yesterday we saw a 9-year-old girl with a tumor in her eye. Today she had her biopsy and we're waiting for the results as the biopsy will be sent to Australia. Then she'll probably need aggressive treatment which might not be available here in East Timor. We've seen today, starting with a case of an older gentleman with a tumor in his mouth that's been growing for 2 months. I think this is a carcinoma or a cancer coming from chewing betel nut. This is a common problem here. Mostly it's women, but men chew betel nut too, and those cancers are very difficult to treat. We went to see a gentleman who's 39 years old, and he has his second case of tuberculosis, having just finished treatment 2 months ago. Now he has tuberculosis back again, and not only that, he's developed white sores covering his mouth. I'm almost positive he has HIV. I think his resistance is now down to the point where any kind of bacteria or fungus or even virus can attack him and he cannot fight it off. Here in East Timor, we do not have a program to address this problem. And sadly, I think we're in the midst of an epidemic, and we haven't done what's needed to get a good control on this, and it's only going to get worse. So I think in the near future, this will be a heavy burden for this country. Then we went to maternity and we saw a woman with tuberculosis who's pregnant. Her tuberculosis is getting better. I thought she was going to die too. I think we'll save her, but the placenta is not growing and the baby is not growing. So what we'll be dealing with in the near future is a newborn baby that will be under severe stress, and we don't have the facilities to do a good job with this. Going on to the next patient, we had a young boy, a 3-year-old, coming from Atsabi in the mountains. This child is blind, probably from vitamin A deficiency. It's because at this time of the year, there isn't that much food. He probably didn't get any vitamin A in the last couple of months, and I can see one iris herniating through the cornea. That's a very bad sign. I think that eye will be useless. It'll be destroyed. The other eye, I'm hoping with vitamin A we might be able to save. But we don't have a good way of dealing with malnutrition at this time of the year up in the mountains. It's still there. Then in the next bed we had a little girl with acute rheumatic fever and carditis. That's a huge problem here. It goes unrecognized most of the time, and the after effects are diseased valves in the heart, especially mitral stenosis. We have many cardiac cases. Tetralogy of Fallot. Here's another whole page. Mitral stenosis. Here's 3 more mitral stenosis just from the last week. Most of these can be done with just a balloon in the valve, popping it open, but we can't do it here. So those are all cardiac cases. It's true Rotary helps us with some of those, but only a drop in the bucket. In my book, I probably have 200 names. They aren't going to get taken care of. I cross them off as they die. Then we saw a man that fell out of a coconut tree and fractured his cervical spine. He is now quadriplegic. We have another girl who was coming in later. She had a tumor growing in her throat. That turned out, we were lucky enough to get a biopsy sent to Australia. It turned out to be a lymphoma, very aggressive lymphoma. 19-year-old girl, college student. Luckily, one man in Australia donated the chemotherapy for us to administer here. We have no business doing that here because we don't have the infrastructure, the laboratory, to take care of any of the complications. But we had no other choice. She was going to die within weeks. It was obstructing her throat. One of the problems that we have here in East Timor is we're basically without any pathology. That means we have to use our stethoscope and our hands and try to make a diagnosis, and then we use what's called a therapeutic trial and see if the medication works. You can't even get a pap test here in East Timor. There is no pathology. There have been some volunteers here, but we don't have a pathology program. We do run into a lot of children's problems. I would say the most common things are infectious diseases such as tuberculosis, malaria, gastroenteritis, pneumonia. But we also run into all kinds of congenital problems and a lot of genetic difficulties. I think it's because we're on a small island, and so genetic recessive traits have a tendency to show up more often. Cleft lips, cleft palates, focomalia, one arm smaller than the other. Other deformities we run into all the time. Imperforate anus. We've seen maybe 10 or 15 cases of that. Very common. These are things that we have difficulty with. We don't have the facilities. We can't do the proper x-rays, laboratory, and we don't have the surgical capacity or pre-op, post-op care. And so a lot of these people, sad to say, go untreated. This is the busiest clinic in East Timor. We have cases that are beyond our capacity maybe every 2 or 3 days. And we have to struggle. And it's like putting your finger in the hole in the dam. Another one comes out, another one comes out. It would be wonderful if we could work in cooperation with groups to be able to address these problems. East Timor is half of one island, less than 1 million people. It would not overwhelm any country. I've seen it over and over again. From the military all the way down to civilians, everyone wants to be helpful. It's a matter of putting the pieces together, and it could work. We could do so much good.
Ami kanta hotu ona maung alin sira, kanta dia kanta at ami kanta ona, kanta dia kanta at.